understands what a devastating consequence Trumpcare will have for American health care. Can't we come together with a better vision? Can't we come together and make the marketplace work better? Restore the reinsurance that's ripped apart the ability of insurance companies to go into new markets? Can't we restore the cost-sharing payments that buy down the premiums, in fact, improve them, so the lower premiums and lower deductibles? Can't we come together and do a better job of funding opioid treatment? Can't we come together and take on the high cost of drugs in general, which is driving costs in the healthcare system? Just those four things would be something very positive to make our current healthcare system even better. Let's work together to make healthcare here in the United States of America even better, not tear it down and destroy it as being proposed by my Republican colleagues. Thank you, Mr. President.
Mr. President.
Senator from Virginia.
Mr. President, thank you. I also rise to talk about the health care proposal on the floor, and I thank my colleague from Oregon and all my colleagues who've taken the floor on this. I'll just state at the top a punchline. I will vote for any health care bill that meets President Trump's promises. He said his replacement, no one would lose coverage, no one would pay more, no one would get kicked around because of a pre-existing condition, and he wouldn't cut Medicaid. And any bill that meets those criteria, I'm voting for. But I won't vote for a bill that shatters all those promises, and that's what this current proposal does. There's a lot to talk about with the bill, and I just want to talk about one thing, the proposed cuts to the Medicaid program, and especially the effect of those cuts on children. In the current Senate proposal, which is being sort of adjusted and modified, though, there's a slashing of Medicaid by about $770 billion over 10 years. And if you add to that additional cuts to Medicaid proposed by the president's budget, we're now north of $1 trillion of cuts to Medicaid in the next 10 years. Who is it that receives Medicaid? Who is it? In Virginia, between 50 and 60% of those who receive Medicaid are children. 600,000 young people are Medicaid recipients in Virginia. If you go to school and you're receiving an individualized education plan because you have a designated disability, Medicaid is paying for it. About 50% of childbirths in Virginia paid for by Medicaid. If you're a kid that's doing everything right, but your family's dysfunctional and a juvenile court judge has to decide, wow, do I keep you with the family or put you in a group home? Wow, I can send a social worker into your house 5 hours a week. Medicaid pays for that. If you're a child with autism and you're getting services for your autism after school so you can succeed in school, Medicaid pays for that. 600,000 children in Virginia receive Medicaid. We recently had the administration's OMB director, Officer of Management and Budget, Mick Mulvaney, before us, and I asked him about these Medicaid cuts. These cuts are catastrophic. How can you say that these cuts are a good thing? And this was his quote: "We're no longer going to measure compassion by the number of programs or the number of people on programs like Medicaid. We're going to measure compassion by the number of people we get off those programs and back in charge of their own lives." So the philosophy that drives this is we want to get people off Medicaid and back in charge of their own lives. Kids. 600,000 kids. I had a roundtable yesterday in Springfield, Virginia, here in Northern Virginia, and I had 5 families, parent and child, come to talk about what Medicaid cuts would mean to them. Angie and Anna are from Haymarket, Virginia. Anna is a little 5-year-old, and her mom says, typical in so many ways, loves to play with brothers, loves to play with dolls, but she's got cerebral palsy and tracheal bronchial malacia and subglottic stenosis and chronic lung disease. In 2014, she developed a condition that caused her to have 30 bone breaks in 18 months. Anna's in school. Anna's in school with a wheelchair that Medicaid pays for. Anna's in school with some home health that Medicaid pays for. Medicaid enables this child who has so many needs to actually go to school so she can be all that she can be. Her family has Tricare through the military because the dad's in the military, but they couldn't make it without Medicaid. Jen and Kaylin from Sterling, Virginia, also in Northern Virginia. Kaylin's about 9 and a half. And within a week after she was born, the family knew that there were some things wrong. She was diagnosed finally at age 3.5 with a very rare, non-inherited genetic anomaly. The family was able to get her qualified for a Medicaid waiver when she was about a year old. And this is secondary insurance. The family works, they have private insurance, but it doesn't cover wheelchair, hospital bed, things that she needs to succeed. And again, this little girl who's 9.5, and her mother testified that she functions on about the range of a 6-month-old. She's able to go to school because Medicaid can pay for some of this technology that she needs. Kim and Isaac from Ashburn, Virginia, in Loudoun County. Isaac's a youngster, real active kid, but he's got a tracheotomy. He's feeding tube dependent. And his family has private insurance, but they couldn't get along without Medicaid. He's in the Loudoun County schools succeeding because of Medicaid. Another kid in the Loudoun County schools, Corinne is the mother and Dylan is the son. Dylan has a rare neuromuscular disease called spinal muscular atrophy with respiratory distress. He has a tracheotomy tube. He relies on a ventilator to breathe. Little Dylan was there in this meeting. The family has private insurance, but they couldn't succeed without Medicaid. And Dylan's able to go to school because of Medicaid. And then finally, a family from Richmond, Amy, the mom, and son Declan. Declan's not in school because he's only 18 months old, but he has cerebral palsy. And his medical needs are intense, but with Medicaid, he's able to get some home nursing help. He's able to get some machinery at home that helps him succeed. These are beautiful parents, one of whom had adopted her child first as a foster care and then adopted knowing the special needs of this child. This was Angie and Anna. These parents are the saints of the world, and these kids, they're fighting so hard. They're fighting so hard just to try to develop every talent they have, every capacity they have. But with Medicaid cuts, they would be in deep, deep jeopardy. Why would we vote for a bill that slashes Medicaid to families like these when President Trump said we're not going to cut Medicaid? Why would we vote for a bill that shatters those promises, that takes health insurance away from 20 million people, that increases premiums for seniors, that subjects those with pre-existing conditions to being cast in the shadows yet again? And that's what this bill would do. And I'll just conclude. I had a conclusion written, but I'll tell you, one of my moms yesterday gave me a better one. She gave me a better conclusion. We had this roundtable, 5 families. We had some great folks from the American Academy of Pediatricians who were there too, saying what a bad bill this would be for kids. And one of the moms, after the hearing was over, looked at me and said, you know, they kind of picked the wrong group of people to fight with, talking about this bill. And I said, what do you mean by that, wrong group of people to fight with? She said, parents of kids with disabilities. I said, I don't get where you're going. And this is what she said to me. From the moment our children are born, all we do is fight. We fight so that our kids can survive. We fight so that our kids can have as normal a life as possible. We have to fight with hospitals. We have to fight with insurance companies. We have to fight with school systems. We have to fight with cultural stigmas about people with disabilities. All you do if you're a parent of a child with a disability from the day they are born is fight. And if they think we're going to pass a bill to cut Medicaid to these kids and their families, and we're not going to fight about it, we're not going to stand up and be heard, they have seriously underestimated us. I think we can do the right thing, as my colleagues have said, if we will get together. I'm on the Health Committee, Health, Education, Labor, Pension. The only topic that has been taboo on my committee this year is having a hearing about health. We've had hearings about nominees. We've had hearings about the FDA. We have not been allowed to have a hearing about this health proposal, either the House bill or the Senate bill. Have a hearing, listen to patients, listen to parents, listen to hospitals, listen to doctors, listen to people who are worried about their premium costs, listen to insurance companies, listen to medical innovators. If we listen, we will get this right. But if we shut a process down, don't allow the public in, don't listen, don't have hearings, and rush it through, we will get it wrong. This is the biggest sector of the American economy, and it is the most important expenditure that anybody ever makes in their life on behalf of the 600,000 children in Virginia and the 30 million children in this country who receive Medicaid. Let's get this right. Mr. President, I yield the floor.
Mr. President.
Senator from Idaho.
Mr. President, I have 7 requests for committees to meet during today's session of the Senate. They have the approval